Hi there, my name is Scott Phillips. I'm the president and founder of StarFish Medical, a medical device development firm. One of the things we do at StarFish is we run an annual conference for medical device entrepreneurs and entrepreneurial companies, and we bring medical device experts from all over North America with a particular focus on serial medical device entrepreneurs. Something that occurred to me after we'd done a few of these is people would really appreciate longer form interviews to hear more of the background story and sort of distilled wisdom of these people. So we started a new series. It's called Medtech Adventures, and they're longer form interviews, about 30 minutes, edited down of the real wisdom that these people can offer to us. Our special guests today are Kris Shah and Frank Baylis, and their story is fascinating. I've got a chance to learn some of it in the past, and looking forward to seeing more of it or hearing more of it today. We'll discover our way into their story. And so 30 years ago, they started a company from scratch, or sort of from scratch. You'll hear more about that. And they built it up, lots of twists and turns and partnerships and experiments. And just this year, they actually announced a deal, the largest medical technology deal in the history of Canadian medical technology, with a $1.75 billion US deal, which is very, very impressive. And so today we're going to find out, we're going to get a chance to hear the story of how they actually pulled that off. So with that, let's get into the story. So welcome to the show.
Yeah, thank you, Scott. It's a pleasure to be here. So first of all, happy birthday, Scott.
Oh my God. This is what I'm doing on my birthday.
Yeah, there you go. Can't think of a better place to be.
Shows true dedication to your playbook.
That's very true, yes. Well, it's true.
Yeah.
This is the day, and it turned out that coming to Toronto this day would be the right thing. So thank you so much.
Here. Yeah.
Great. Okay, so let's just get into things here. Maybe we'll talk a little bit about your respective childhoods. How is it that this entrepreneurial impulse, where did it arise from? So maybe you can take turns.
Yeah, sure, Don Scott. So first of all, thank you for doing this. I was born in India. Then my father actually immigrated to Canada in 1969. Mm-hmm. And the rest of the family immigrated in 1974. So we grew up in Hamilton. That's where I was raised, went to Delta Secondary High School. And throughout high school, I went to like a technical high school, and I took all the kind of the electrical trade, and I was going to actually become an electrician in that out of that program. Then one of the teachers kind of talked me into going to engineering. Mm-hmm. So I decided to go to University of Waterloo for electrical engineering. That's where we met. And I think some of the formative years and where we ended up kind of really formed at Waterloo, going through the co-op program, working for different companies, different kind of setups, and realize what works for us, what doesn't work. And that's where kind of the genesis came from. And I think very early on in that co-op structure, we kind of decided that we want to be self-employed rather than work for someone. So that's where the idea that we want to be self-employed came about. And then a series of businesses kind of took off that we'll talk a little further about that kind of led us to where we are. But that was the genesis, that we want to be self-employed. And
did it actually happen in the co-op program, or did you have the impulse before?
I think impulse kind of came out of the co-op program, even though back home in India, a lot of my immediate family is in business, but relatively small kind of business, trading kind of operations, so forth. So we have some kind of history of business from that side, but it really came out of co-op, looking at different bosses, different structures we looked at to say, it'd be better if we're self-employed, kind of control your own destiny and future rather than working. Mm-hmm. That was kind of the essence of it. Then also just who we were probably as people, Frank, myself, that we want to be entrepreneurs at that time. Back then, entrepreneurship was not a big thing, kind of wasn't the vogue it is today.
That's true. So Frank, how about you? Where did your entrepreneurial impulse come from?
So for me, it's, well, first of all, a bit like Kris, I am actually born in Montreal. I'm born in Montreal, but my parents are both immigrants. My mother from Barbados and my dad from United Kingdom, England. But I had the bug right from the very, very young age. Wow. I remember the first business I had was selling little stickers, and my mom asked, where'd you get that money? And I said, I had these guys selling stickers for me. And she told me,
other kids to sell stickers.
Yeah, she says I wasn't paying them enough, but I had to. So, but I always had that idea that I wanted to be in business for myself. Like Kris, we both had paper routes. It's a small business back then, and you're running a small business. And then in high school, I was with another friend. We had a business called B&B, where we were painting, doing small carpentry jobs, mostly for our school teachers and that, but other people as well. And that was before they had College Pro Painting. Before that, and I saw what that guy did with College Pro Painting. So I had that in the back of my head right from the start, that I was going to try and start a business. And when Kris and I met at our first co-op work term, I think we were very complimentary in that, and we both had the same ultimate vision, which was to go out into the world and create something from that. And for me, it was a very strong call, though, that I wanted to be in business.
Okay, so you guys met, and I believe it was a board of education. Is that
Yeah,
that was your co-op term?
Yes,
That's like the dullest sounding co-op term you could find. So how did these exciting, fiery entrepreneurs choose that for? And sorry to
we started university in September '81. So I think our first co-op must have been in May '82.
Yeah.
And you go through the co-op process, you get matched or you get matched. So we both ended up at Toronto Board of Education, downtown Toronto.
Yeah.
So there were 4 desks and we were all sitting across each other, and it was a maintenance department. It was actually quite at the end worked out to be quite interesting work. We were kind of installing, at that time, changing, I think, boilers from oil to gas.
Yeah.
So we were doing a lot of project management work with the department, trying to do that, both Frank and I. So that's where we met in '82. Then we went back to school. Then we stayed connected to school, then came back for second work term. I think it was probably during the second work term we started kind of formulating the ideas that we could start a business together. What do you want to do or not do, and what do you want it to look like? So being an engineer, we kind of started thinking a bunch of different product ideas or service ideas, and so we would write a business plan, we submit it to kind of incubation kind of schools.
Yeah, sure.
And try a bunch of different ideas. I mean, maybe like half a dozen or so.
So during school, you decided to start several businesses.
So we take it to kind of business plan level. And remember back then there was a 4th year entrepreneurship class you could take, entire class. We both took it, and remember the entrepreneur who taught it kind of taught us how the basics of 16 lectures, one on each aspect of business, and kind of got us going, write a business plan. Remember one we wrote was years ago, was on like equivalent to what's Fitbit today, kind of keep track of where you are, especially if you fall down, could you notify someone? Yeah. This was well before internet, of course, in 85 timeframe. And we submitted a business plan to some business, kind of local outfit, and they said it was a terrible idea, so we kind of shelved it. But had we taken that further, who knows? So that was kind of some of the ideas we were working on. That's how we came about. Then after graduation, I went to work for B&R in Ottawa for 2 years.
Bell Northern Research.
Bell Northern Research, yeah. It was a big learning experience on learning big company culture, some excellent work that took place, a lot of good technical work that took place. Then I came back to Toronto to work for Northern Telecom, Nortel, mainly so we could be together and start business, because Frank was in Toronto at that time.
Oh, okay.
So we could kind of work more cohesively together and be in the same city, and kind of accelerate the path that could have been otherwise.
You're really still committed. You're going to do something wonderful together.
That's right. Yeah.
Interesting.
Yeah.
What was your vision between the two of you at the time? What would constitute a successful business for you?
Say that we're going to jail, eh?
Not going to jail.
No, I'm kidding. But I think the important thing, and maybe it's helpful for your audience in that, is that there was a commitment to go and be in business.
Yes.
And I think that's really to understand at the start of it. Mine, like I said, started right from when I was very young. And this company, we've done other businesses as well, but this company, Baylis Medical, as we'll talk about, was started by my mother. And when I graduated, and Kris and I, we graduated together, I went right away to my mother after traveling around Europe and said, why don't I join you? She was working by herself, importing and selling medical products, and we can try and make a go of this business. And my mother, being who she was, very strong lady in that, she goes, no, you don't know anything. You got to go get a job for 2 years. And I had in the back of my head that I liked this idea of maybe joining my mom, if we could join and make the medical company out of it. So I went and worked for a company called Laborie. You may have heard of Laborie. It's been a very successful company here. And I worked for Mr. Laborie right at the beginning of him manufacturing his aerodynamic systems.
Right.
So it was right on the ground floor and literally a mile from here, this building, right in Mississauga. And he was a very fascinating, successful entrepreneur. So I got to learn a lot from him. And I can just remember and they treated me very well, by the way. but I would stand at the window looking out, and I felt like I was in jail. I just wanted to get out on my own and start doing my own thing. So that part was very strong. And then Kris and I, we were always kicking different ideas around the whole time, that when he was in Ottawa and I was here, and we were trying to figure out what could work, what couldn't work. But I think fundamentally there was a commitment that we were going into business. That was absolutely primordial. But to say what it was going to be, what it was going to look like, that we would be stretching it if we were to say.
Did you have a sense it would be a product business?
I think, being an engineer, you kind of naturally gravitate towards some sort of product. And I had telecom background, so we're looking at a bunch of telecom ideas, looking at some consumer product ideas. So we're looking at a variety of things all the time. So we would talk to a lot of mentors, that people helped us out. We go talk, what do you think of this idea? What do you think of this idea?
Mentors? You asked for advice?
Yeah, we asked for a lot of advice. I remember one idea we had, sounds crazy now, but it was a furniture for balconies. So you could collapse the furniture.
So that exists now, right?
That exists now. It
Every
did back
Canadian
then.
player has it. But we were talking to a guy that lived in an apartment. He goes, I can't store anything anywhere. You know when you go to Canadian Tire, you got those plastic bins, something like the credenza. And he said, why don't you, we looked, and we never did it, but it was a good idea.
So we looked into it, how you're going to make it, how it's going to be shipped, how you're going to do all of that. Then you write a business plan, you go talk to, who can sell all of this. Then we go to a certain extent, then you come up with some sort of brick wall and you drop it, or interest will move on. So we maybe at least no less than a dozen different ideas we would take to, and we talked to a lot of people, and we got a lot of good advice, a lot of good input, and we were thankful people spent time educating us, because we had no idea about business back then. So we grateful for a lot of time people spent into that.
I find this fascinating, because usually young people, they're full of piss and vinegar and full of pride, and they don't do a good job of going to find out what talk to the people in the market, talk to old people like us, the people who've been around the block with lots of scars.
Yeah. So a lot of people. So we tried maybe no less than a dozen different kind of lines of thoughts. So it wasn't medical or telecom, but primarily around that, because that's we kind of have some natural skill set at. But we tried other consumer ideas and so forth.
Sure.
Then
great. So what was the one that kind of took hold first, that you actually put a bunch of energy into?
So we were, like Frank was at library, I was at Nortel, so we're trying a bunch of this different ideas out. Then I think through Frank's mom's company, Baylis Medical at that time, where I hadn't joined, I think someone approached her about inventing a catheter that could be useful for intracardiac imaging. Yeah. And I barely remember the fellow's name. Frank Stiles kind of comes from mind. So he came, he had a patent.
Right. He wasn't an imaging catheter, but he'd come.
Oh, that's
and
right.
to his credit, when you look back at what he had invented back then, which was a balloon catheter with a distal capture device, like the distal embolization device, which are all big businesses now, and he had put all this thing into one catheter.
That's right.
And to this day, it kind of makes sense if I think about it. And that was 30 odd years ago. But that got us to thinking a lot about catheters. He didn't have the idea of an imaging catheter. He had an idea of a balloon with a distal embolization capture device, all built into one.
Right.
Quite inventive.
So he sent the patent in wanting to license it, and we kind of
wanted you to license it from him?
License from him and do something of that, right? So we're looking at it, and we didn't know quite what to do. Then I think Frank's mom suggested we write a letter to a cardiologist and go talk to him. So I wrote a letter. Back then, there was no emails or even fax. So you write a physical letter, email it, and lo and behold, his secretary calls and say he'll meet you. And I forget the gentleman's, and I never forget that he took time to bring me in his office and educate me on what we were doing. Yeah. And then he soon realized I have no idea what I'm talking about. So he got model of the heart, just look, see this coronary artery, how tiny it is? You got to get this in there, and you want to do all this apparatus. Why don't you simplify it, just do 1 out of 8 things this catheter is doing.
All right.
So that's where we said, maybe we'll just do imaging.
Oh, okay.
That's a kind of common. And then
with an actual tiny camera chip?
Yeah, it was kind of like ultrasonic imaging catheter, what we call ICE catheter today.
Yeah.
So we obviously had no money.
Intracardiac echo.
Intracardiac echo, exactly. Intracardiac echo. So that was kind of the simplification of that. So we got rid of kind of Swiss Army knife idea and kept left with a single knife on it, right?
Yeah, sure.
And then in order to raise money, we put a business plan together to it's called Equire, kind of like say, semi-government agency out of Montreal that would fund these projects. So Frank wrote a business plan. And in order to enhance our chances, we did it under Baylis Medical because at least the company was set up. There was some sort of semblance to it. We thought that would.
Baylis Medical was Frank and his mom.
That's right. Yeah, actually, just his mom at that time.
My mom. Like I say, if she was here, she'd make sure she knew that.
So we submitted the plan, and lo and behold, they accepted it, and they decided to fund it. I forget how much original funding was.
And I think that's an important point because back then, ACPIR stands for l'Agence québécoise de valorisation industrielle de recherche. So Quebec Agency for Industrial Research Support, if you want, something of that nature. And this was the genesis of Silicon Valley and entrepreneurship starting there. There was no VC money. There was nothing in Canada. And Quebec being ahead of the game, their governments were trying to fill that gap, cross that bridge, which is say, can we start to find some way to incentivize Quebec-based companies to do development or fill the role that's not here. Today we have it. Today we have venture capitalists and that. But back then we decided that was what was there, and we went and talked to them. And that has an impact on our thinking as we move along. But we went to there, and there was a gentleman that liked our project. Thought, in retrospect, again, it was way too much for a startup like the size we were, and the funding we were asking was not reasonable when I look back on it. But they funded us, and that started us down that path.
Yeah. Sure.
So I think, based on that funding, if I recall, Frank moved to Montreal, and I was in Toronto doing, so we'd be doing, and I quit my job based on that funding. So it's 91, I left my job in Nortel.
So you're putting it all on the line, your whole career path is
That's right. Yeah, now we quit our jobs, and I remember there was a tough call because my wife was pregnant with our first child, Priya, and then timing was that I had to quit to start this gig.
This is very brave at the time. No venture capital industry.
Yeah, so we had this.
Just somehow believed this was all going to work out.
I think it was all predicated on our being self-employed, being in business. So that was kind of the central element. And the thinking was that we go at this, and if it doesn't work, you can always go back to engineering. We're still young engineers. You can always fall back to your basic engineering and get a job in telecom or something. So we thought we'd try it for a couple of years. So Frank moved to Montreal. I quit my job. And then we started doing the development work, which is obviously a huge thing of transducer imaging systems and so forth. We hired some engineers from Montreal.
Yeah. At the same time, we also were focused on distributing because my mother had that small business distributing. So we said we'd take that and try and expand the distribution business. So we were wearing two hats. We were both.
Oh, you still had the distribution business, or she had a distribution business.
Well, we came together with this project and the distribution business, and it was just herself. So we then now had Kris was looking after sales in Western Canada, from basically Ontario all the way to BC.
So Kris was an R&D engineer with 1 year or 2 years experience working at Nortel, and super techie telecom. Now is selling medical devices. That's a natural career.
working on the development of the catheter and selling, and his territory was from the Ontario all the way west, and I was doing the same for Quebec all the way east, and also trying to develop. So we were doing both things.
I find this fascinating. This because usually people who start technical stay pretty technical adjacent. You guys kind of went the other end of the spectrum, went way out in the market. And I think this is maybe one of the ingredients of the success is that you guys have covered the whole thing.
I would say, Scott, that's an excellent point that you're bringing up. We were facing doctors all the time.
Yeah.
And we were facing doctors, we were developing our own product at the background, but at the same time, we were trying to sell these new products. And I believe that that's been a big part of our success. And a lot of failures that you probably see or challenges that people have is you have a brilliant inventor, but he's never faced the customer. And the customer can be brutal and say, look, this is crap, or I won't use it for this reason or that. And you'll either make a sale or you'll not. So we learned that, and we learned that the hard way.
I think you learn a lot that way, not just dealing with physician, but also like healthcare system, nurses, biomed technicians, administration, how are you going to get PO out, how are you going to get paid. There's a lot of how are you going to sign a contract, a lot of commercialization, mechanics you learn.
Yeah, sure.
And also you learn very fast, like what's your differentiating story that you can articulate in 10 seconds to a physician between cath lab.
Right.
So if you don't have clean story in any product that you can articulate very cleanly and it's going to make sense,
Yeah.
you really don't have a product that has hope of getting entrenched. So you learn.
So it's even the concept of the product relates to how will you communicate it to a doctor.
How are you going to communicate? How are you going to break it down into what's your differentiating factor that you're going to break it down? And if it's purely on price, okay, then you realize you're going to talk to the head nurse and she's going to ask different set of questions on price product versus physician may ask something on the clinical side.
Right.
The other one you learn is that if you're going to go talk to these guys, they're not there to teach you. They're too busy. So you got to know your stuff tight, even if it's very narrow, but you got to know deep. So you got to read every single paper that he could possibly ever read. So if you ask something on, I don't know, we're selling ECG recorders. If you ever ask anything on ECG, you should know it deep as he possibly could. Okay, you're not going to know breadth of what he knows, but you should know the technicalities so you can stand your own. If you can't stand your own, you won't be able to survive very long between biomed, the nurses, the admin, and
you won't be
and
invited back, basically.
Yeah, so you learned a lot, I think, and that, as Frank said, served us well throughout, even today, on some of the basic skills we learned. And even like how you can hire a marketing person, how you can hire salespeople, all of that kind of feeds into it because we know what the environment is.
Right.
And this environment changes. Obviously, we learn how to do it in the US or Japan or Europe. Environment is different, but fundamentals are the same. And once you kind of learn that, I think really served us well over the years.
Amazing. So I should just mention to the audience that there is a Q&A tab at the bottom of your screen. If you want to ask questions, I'll paraphrase them and try to work them into the conversation as we go along here. I got my little screen. We're ready to go. So tell us what happened to the imaging catheter. And
so we're doing the imaging catheter starting roughly from 91. We had it till 96. So we kept kind of on it. Then we realized the project was too big.
Yeah.
And we won't be able to come to sustaining. So we kind of had to close that down, went and talked to Acquire and worked out a phase-out program. And they understood that. And then we stopped that at that roughly 95, 96 timeframe. But between 91 and 96, as we were distributing products, that part of it is doing quite well. And a bunch of interesting things happened even when we were distributing. There was physician Dr. David Newman in Toronto at St. Mike's. He had purchased a machine called OWL RF system that was used for neurological work. And it wasn't working for him, so he had called, and I went and saw him, and he was, look, I'm trying to use it for cardiac ablation. And cardiac ablation was brand new back then. It just had been invented. He had trained.
Is this atrial fib application?
No, it was for just WPWs or ST, or for just kind of the atrial ablation at that time, mainly on the right side.
Right.
And he had just come back, his fellowship at UCSF, so he had kind of learned about cardiac ablation, was brand new. And he had bought a machine, it wasn't working, but he goes, so then we kind of dug around, looked into it, and we said, okay, the machine you bought is not powerful enough for what you need. So we contacted a company in Germany called Asipka, and they had a machine that was powerful enough, said, this is what you need. So we imported that and sold that. Frank did conversely, same in Montreal. And that kind of got us going on cardiac EP.
Right.
And
electrophysiology.
Cardiac electrophysiology so we started selling cardiac ablation system, then we started selling cardiac catheters from a company called EPT. And we slowly grew that franchise out. So we had large cath recording system from Pruka simulators, and eventually got it Holt recorders and loop recorders. We're the first company to bring loop recorders in Canada.
So this is still all selling only in Canada?
Only in Canada,
all
exactly.
import licenses first for Canada.
That's right, yeah. So we kind of became experts in cardiac electrophysiology across Canada and distribution.
Yeah.
So that's how we kind of made our name. It was and that business was doing fairly well. So we stopped doing the development and carried on with this.
So you killed off your first product.
Exactly.
Product baby.
Exactly.
Okay.
So those are kind of times where you were selling, but also trying to get product lines that you could sell here. We had a small service depot where we could repair or get products through CSA kind of registration bit to do that.
Right.
It was a small operation. There were 4 or 5 of us between Frank, myself selling, Frank's mom doing admin work, and a couple of kind of admin help to
4 or
get
5.
that going.
So you hired other people and managed them to do this job?
A little bit, yeah. We needed warehousing help and a few admin kind of roles, so we hired that. But mainly us on the ground selling and doing all the work.
So now, I mean, when you sold your company now, it was not in distribution. So how did you make that transition? How do you decide? And what was
you
the
know,
journey?
so between 96 and even 2000, you know, we would say like product line. Say, I'd give you one good example is that we were first in Canada to bring Holt recorders, King of Hearts, and some of the physicians would recognize that name. So we were brand new concept. Loop recorder came in, so we were importing them, selling them in Canada, and business takes off.
Yeah.
But conversely means that it's taking off everywhere in the world because good technology and is selling. So lo and behold, I think Physio Control came along and bought Instrumatics and made those loop recorders.
Right.
And they don't need us in Canada, so you lose a product line.
Right.
Okay, you pick up, you know, we picked up Delmar Holters or something, so you pick that up. So eventually they get sold.
Right.
So if the company is good, someone will acquire them and they don't need us in Canada. And Canada is the first country they let go of distribution because we speak English, we're next to US,
Yeah.
first country they can go direct in. So we're the first ones to lose that. So business kind of goes up, comes down, goes up
Right.
and comes down. So you never a steady state,
Yeah.
kind of evolution into that. Then I remember Frank and I were up north in the cottage country, and Frank gets a call from Matt Pruka from Pruka Engineering, and we're selling the large cath lab systems.
Yeah.
And they were very, very lucrative for us. They were like $250,000 sales, and we're selling one in each cath lab in Canada and doing good at it. And he goes, "Good news, boys. I just sold, GE just bought us." Okay, and the first thing is, "Good for you, Matt." Okay, now what does it mean for us? You know, so so we realized that business is going to go down again. And I think right there and then we decided, okay, this is too tiring and too hard because we're not going steady up, you're going
Right.
up and down, and we're too young for that. So we said, only way we can stay in this business is if we have our own products that we can control our own destiny on, or we're just going to go get jobs. You know,
Right.
so go back to. So that was kind of, remember, even to the day it was crystal clear. We're going to go one or the other.
I love
And,
it. I think you explained before that you guys sitting in the phone booth.
Yeah,
exactly.
Each of you had
that's right. That's right.
Yeah, there's no cell phone back then.
life-changing story.
Yeah, that's right. There's no cell phone
Yeah,
back then.
we had to
and, you
call
know,
from a phone booth.
Yeah. There's no,
I think one of the lessons too is that, and to Chris's point, touching back when we accepted that the imaging catheter, there was a lot of lessons in there. We realized that we'd bitten off way more than we could chew. Another lesson I remember getting is we were at the conference one place, and there was another company in the States that was developing a nice catheter at the same time we were. And they had it sort of working, and they were showing it at their booth. And right beside it was the first hydrophilic coated wire from Terumo out of Japan. And I remember looking over at this, as an engineer, looking at this amazing technology of an imaging catheter, this console, the catheter working the whole bit, and no one there. And right beside them, doctors were 5 deep to touch the first hydrophilic coated wire. And I thought that was a lesson too. It's not about how interesting the technology is as a person to you as an engineer, but what is the most useful to the physician.
Right.
And they're lining up, waiting their turn just to touch a guide wire, which I thought, okay, what is it? It's a wire with a coating on it. But that was now everybody knows what a hydrophilic coated wire is around the world. They're used all the time. But I think there's lessons that we learned in there too. We come back to that phone call. We said, okay, we're going to go back in to trying, but we're not going to bite off more than we can chew. We're going to take something bite-sized, and we're going to we've been out selling things, so we're going to look for what physicians really need, not what we find technically interesting. And that's a challenge that a lot of entrepreneurs have too. They have these wonderful, amazing ideas, but how absolutely relevant is it to the practice of medicine?
Right.
And how much are you going to really impact the practice of medicine? Are you going to have something that they're going to line up and wait their turn to see your product, or are you going to have to be pitching it? And we learned that lesson. Combined with that,
tough lesson of selling stuff day to day.
Yeah.
Pushing things uphill is no fun.
seeing what was working, what was not, and then we had that phone call, and we were there with our families, just rented cottages on Rice Lake, and Kris and I said, that life of a distributor, what you're doing is you're renting your sales force. And we built up, maybe we were about a dozen people, so you build it up, it goes down and up and down, and we said, look, we don't want to live that life anymore. And so we went forward from that point. We were still distributing because we had other lines in that, but we made a fundamental decision that we're going to become a manufacturer. So that's the turning point. We also had learned lessons. We're going to do things that the physicians really want and need and impact immediately, and don't be impressed by the technology. be more impressed by
I
the
think
solution.
the other kind of aspect of this whole experience with Acquia and so forth, that kind of another formative aspect that came out was that when we're dealing with Acquia, we realized that they have their own agenda in terms of creating employment in Montreal or Quebec, for instance, or their other, how fast you spend the money or don't spend the money, or what your quarterly burn rate is, this and that. So they kind of impose a set of restrictions on you that were necessary for their program, but not necessarily decisions you would make in absolute openness of what's optimal for business, you know? So when we were kind of having to go back and doing the development work again, we realized that if we could do it without those constraints, we could do a better business kind of decisions into that. And also the amount of energy it took to deal with them and kind of massage your messages all the time and dealing with it, that kind of left a kind of distaste in us, if you will. And if you could live without that, we thought it'd be better.
That's an excellent point about why we, and people look at why we never took money. We talked all the time to investors, and as we became more successful, more investors were interested in dealing with us. But we had learned, that lesson is a great lesson that we had learned, is that we want to build a business long term in that. And we didn't want to be spending time talking, whether in this case it was a government agency investor or another investor, and nothing against venture capitalists or necessary when they're there, but we made a really clear decision that if we could avoid them. And there's another anecdote I'll share. I remember, you know, when you meet people, they all say, you should come and visit me one time. So I was like, yeah, I'm coming. And then I'd call the next week. Remember you said I could come? So I would always go and see what they're doing, get a tour of their plant. And there's a fellow that was developing a new interesting wireless telemetry system for hospitals. And he was older than me, and he was always so excited about his stuff. And so I would go and see him and learn. And one time I went to see him, and the spark was gone. And he had just raised back then quite a lot of money, and he was really happy he raised the money, but then the spark was gone. He goes, you know, Frank, I'm just an employee now. And I remember that to this day, that kind of sting that he was not doing what he wanted, the rate or whatever. And so we also made a very clear decision. If we can avoid taking outside money, we'll do so. And that comes back to the distribution business we had, which even though we had lost Pruka, was still successful in other areas. So we said, we're going to take, and we made a very clear decision. When we had good years or not, we're not buying nice cars. We're not, all of that, the last nickel is going back into development.
Right, so business A finances business B.
So when people look at how were you able to do this, it was planned, we were lucky to have a distribution business, and we clearly we had some great years, but we didn't take, no money was coming out for us. It was all fed back into trying to get our own products.
In the course of doing this, I've talked to a lot of people that had great exits, but none of them had great exits where the money was there. It's like,
when we asked that, and when they talked to us, and people asked, they had to ask even the potential purchasers a couple times. So you know, when you say you own it, right? And we say, yeah. So when you say you own it, there's no other investors, right? They'd have to ask 2 or 3 times because it just was not the norm to see a high-tech medtech company that didn't have investors. But that we were lucky. But that even for the potential acquirers, it took them a few times asking that same question just to make sure that, you're talking to the 2 owners. That was it.
I think the other part of kind of learning out of this distribution business, besides kind of sales and this Acquia experience, other key was that we're dealing with, say, half a dozen or dozen companies that we're distributing for in Canada. So as a result, you have a chance to visit them, talk to them, see their structure, talk to the regulatory people and so forth. So when we took that opportunity, as Frank said, come visit us. So we would go there once a year if they invite us, go see the plants. And if the conference was in city close enough to them, we go visit them, take a look. So when we started doing our own development, all of those contacts were super handy. And the kind of the formation of what does the guy's R&D lab look like.
So it's kind of like a business education.
Exactly.
Real business education.
That's right. And those people were very, very helpful. You know, so when I remember doing our first 510K, and you have no idea how to do one, so you get a book from FDA and you read it and you write your first 510K down. And FDA is a big kind of scary animal, so you don't know what you're going to send in. So you had access to some of these folks, like, can you review it and see what you think of it, So it kind of gave a lot of input into that. And even setting up a quality system, okay, what does that look like? Okay, let's just talk to someone and how they're doing it. And people were very helpful, and we were able to learn from that. And that was another part of it that kind of helped accelerate our own development and had access to those skill sets that came in very, very helpful, I think.
Can you talk about what was the first product you had any success with of your own?
Yeah, so very first product we made was a relatively simple product. It was a RF cannula. It was a disposable cannula. So we're selling a system called Daros, and they had everything was reusable. They didn't have a disposable cannula that went with that. And there was a need for disposable cannula in the US. So we could not really sell a system without that.
Right.
So we took that on. I remember doing the first 510K in 97 or time frame or something. And then we got some companies to make it for, like a company, Hard Medical, to make it for us. And we're writing the 510K and submitting that and getting that approved and started selling that. And I realized very fast, you need all the infrastructure for quality system and all that kind of stuff. And you're relying on third-party company to make it.
Right.
And you first start off, maybe you need 50 or something, or like hardly any volume. And very few people are interested in setting up a machinery process for you to make that. So again, the product manufactured itself is not an easy thing. So when we started doing further development, we realized we better just have our own manufacturing setup such that we could kind of get the product out the door, even if it's very high cost. At least you could get it out the door versus just kind of begging someone to do that. So the first product was kind of relatively simple cannula that we made, but it was fairly intricate at that time in terms of insulation and so forth that we needed, and had to get a couple of manufacturing companies to make it for us. That's how the first product came. Then eventually we took that cannula and made in 2 years later, did a development for the entire pain management system. That was much bigger bite to take.
What is that? That's ablating nerves?
Yeah, so the idea was it was an interventional pain medicine. It was a small business back then and kind of took off. It's much, huge business today. So the idea was kind of emerging that for mechanical low back pain, if you can ablate in the facet joint some of the fine nerves that are causing that pinch between the facet nerves, you could stop the signal from going to the brain that part of the body is injured. So we were kind of selling a system that did that in US, but a kind of new technology came along at a time called Pulse RF, and that system didn't have that. So all of a sudden we're selling and business drops to zero because we don't have that particular feature. So as a result, we said, okay, in order to survive in this area, we're going to have to develop our own system. And at that time, we knew the demand, we knew what the features had to be and how we're going to sell it and how we're going to differentiate it. So knowing everything from our distribution know-how, we kind of created product spec.
You started from the market back, basically.
Market back, exactly.
That's
market
really
back.
interesting.
And then one of the companies we were selling for was called EP Technologies, and they had used a company called Stellar Tech to do the development for the generator.
California.
Yeah, California. So we said, okay, we kind of know them, we visited them, let's use them for development. So again, that kind of connection to distribution came in very helpful, and Stellar Tech helped us develop the kind of the main electronics. Then we did the disposables ourselves into that and set up the initial production line for the disposables into that. But
there seems like there's this sort of intuitive thing here. You just kind of feel, because of your being in the market, that this is going to be a big space, that we should go over this direction. Can you talk about how did you decide to double down on that?
Yeah, I think it's more maybe to look at it that we're trying to do something and it's not working, or they're not buying. If we're more brutally honest, it interconnects itself all the way through. So starting off where we were selling this neural system, it was for very unique, where they would go in and ablate non-operable cancers in the brain as their stereotactic systems. And then suddenly Dr. Newman tries to use it for cardiac. Okay, why are you
takes a brain catheter and tries to use it in the heart?
The brain box with a touch to a catheter, and it's not working right. Why are you doing this? So that leads us to say, okay, well, maybe there's someone in the world that actually made the right box for this. That led us to SIPCA. That led us to start opening the door in the electrophysiology world, which was just taking off. And then someone else says, okay, I'm using this RF box and we're trying to treat back pain. Okay, but it's designed for the brain. Okay, what are you doing? Well, I need a cannula I throw away. The manufacturer doesn't want to make it because he doesn't see himself in that mold, so we start making it. Then what happens is they say, okay, the next thing in this area is I want a pulse. But we say he doesn't want to make that. Fair enough, it's his business. So then we're say, okay, do we continue selling or do we stop selling in this area? If we want to continue selling, the market is telling us they want
having
this.
A very, very strong feet on the street. could really hear those signals,
and we are
that you'd never hear.
And we
otherwise.
are selling ourselves.
Yeah.
So it's not some salesperson coming back and feeding to us, I can't sell it. It's us being told right by the physician. So it becomes very apparent to us. So then we come to a crossroads where at the same time we had already made the decisions that we're going to start our own business. There's a market pull for this. Then we, as Kris said, we were selling, and by then we'd moved from Osipka's RF to this EP Technologies, which ended up getting bought by Boston Scientific. And they were the first North American developers of cardiac electrophysiology. So we were distributing for them. That opened the door because we were visiting them. That opened the door to Stellar Tech to work with them to develop the box. So it's interwoven, but I think we're following the customer as opposed to trying to impose on the customer what we think they should have, and listening and hearing.
When you did that, what happened?
So, I mean, to Frank's point, it's a lot of pivots rather than a kind of grand strategy that you articulated. So you pivot, and even though you get signals from the market, there's room for it. Signals are never absolutely clear. There's a lot of muddiness.
Yes.
Then, you get a signal, can you do it? It's a big development. What's the FDA going to look like? How are we going to set up? So a lot of questions that come, but so there's never a moment of certainty that arrives.
And so how do you approach that uncertainty? Do you just try little experiments, or go talk to more people?
Yeah, I mean, you can do that and kind of validate there's room for it or not. But at the end of the day, you got to take a step forward and bite the bullet and say, okay, we're going to do it. If it doesn't work, here's our backstop. It's going to cost us whatever, $2 million. If it doesn't work, okay, we'll survive and live to fight another day, right? So the moment of certainty almost never arrives. Doesn't matter how much information you get. So you have to take a leap of faith. So we took a leap of faith. Okay, we'll do the development, and there's a lot of uncertainty. As in, can we do the development? Even if there's a need for it, can we get the development done? Right? Are we going to be able to navigate IP? Are we going to be able to get FDA approval? So a lot of uncertainty that you have to kind of have faith in yourself or your team to say, okay, we'll overcome it and do that.
Right.
So that was kind of genesis of doing it. And if you want to be in this business, you have to do it or not do that. If you don't do it, okay, you're going to have a bunch of consequences as a result of that. So as a leap of faith and courage, you go with that and make the big development at that time.
And were you imagining that you were primarily making for the Canadian market, for the world market, or?
Yeah.
We're the U.S. because that's another. We were talking earlier about that. Yeah. At first, my vision had been, let's conquer. Let's get ourselves really strong in Canada, an east-west vision. And Kris was all saying, let's go north-south. Let's move south. And Kris was right. And as we moved and started selling that what became the pain system in the States. The States were bigger, much bigger market, much faster to make decisions, a richer market. And so we learned that lesson, and that's a lesson we could share with everybody, that it's easier to sell at that bigger market. So we started doing that. And I think that the demand was enough, but if we're brutally honest, there's a lot of products that we just made stuff. Some things we sold a lot of, some things we didn't sell much of anything. And in the pain management world, we made a whole slew of products. Some took off, some didn't. But the ones that took off worked for us, if I could say that. But it would be wrong to say that we got it right every time. That's not a reflection of reality. A true reflection would be that we tried a lot of things. Some things really worked, some things didn't.
But you were kind of honest, brutally honest, and saying this isn't working, let's kill it.
Yeah, and I think that we didn't spend any time really trying to assign blame or worry about why it didn't work or that. I think we just accepted and having learned that lesson much earlier on, because when we're not selling our products but someone else's product, this is working, this is not, that really allowed us to move with speed and clarity. And so when anybody looks back, they go, okay, it's like the Beatles. You think every song they wrote is a hit. No, actually, there's hundreds and hundreds of songs you never heard of the Beatles because they weren't hits, but they wrote way more. It's or the Pete Rose story that he got most hits in baseball, but he also has the most strikeouts. So I think just taking the chances and trying to address market needs. Some were big, some were small.
Great. So you did decide, somehow you guys had an arm wrestle and decided to try out the U.S. market.
Yeah, so we kind of got the product and trying to sell it, and we were trying to decide how we're going to market it because we didn't have any commercialization entity in the U.S. at all. But luckily, we got introduced to a fellow art segment at Kimberly-Clark, and they had just bought a company called Ballard Medical, and they needed our class of products to sell into it. So it was kind of very fortuitous that they needed us and we needed them. So I remember going to Salt Lake City and doing the demo and kind of cutting a deal with them to distribute.
We should tell, when we were looking for other demos, it's worth listening to the lesson here we learned when we first went to Medtronics many years ago, and we had a meeting in Minneapolis at Medtronics. We printed booklets, we brought everything, we flew down, and the guy walked in and there was you want to tell him the lesson we learned? So he comes in and we're very proud of our technology, and he looks at the thing and he looks at that disposable can, that's the repeat business or the razor blade business. And he looks at it and he says, nickel and dime. He puts it on the table, he walks out, and slowly but surely everyone else walks out, and all our presentations are still sitting on the table. we kind of knew the answer as we packed up, that.
Nickel and dime.
But that lesson taught us another lesson, which was we were going to make ultimately high-cost disposables.
So
because of that nickel and dime,
margins were not high enough.
Well, for him,
that's right.
Now they got into it. There's a great story because they ended up buying many years later a whole pain management system from us.
I mean, so we had a box, and we're very proud of the box we got, and we got this low-cost disposable, and you could see math working. Okay, I sell a couple hundred of these boxes. Now what? And I got $15 disposable.
Oh, I see.
So then he goes, okay, there's no
money
business
in it.
here.
Right? He didn't say all that. He just said it was much more precise and concise what he said.
So
but
when he walked out, he realized at the airport, you're going, what just happened here? Right? Okay, he just realized that all the box that we did all the thinking for, they don't really care about that. They're just enabling mechanics. You need the high-cost disposable.
Right.
So we said you need at least $1,000 disposable. You need to get $1,000 per revenue per patient if you're going to be a viable company.
Right.
So that was kind of, we said, we got to go to work on how to make $1,000 disposable, not a $15.
Yeah, and then what happened is Kimberly-Clark was already selling other needles, so for them to add another $15 disposable needle into their kits made sense for them. So it kind of worked. It worked out nice like that. But we'd already learned a new lesson, which we've never forgot, which was that let's start looking at technologies that if you look at all these businesses, they have razor blade models, but they're looking for that high cost disposable. That's the driver.
I'd say our deal with Kimberly-Clark was a major inflection point because in a sense we got a distribution agreement with large company, and we had a minimums built in that had to buy so many boxes and so many disposables and so forth. So we could kind of bank on that cash. So that was another reason we didn't have to raise money because we could rely on that distribution income. And we knew what the margins were, so we knew how much cash we're going to generate based on the minimums. And we used that money to build out our infrastructure. So we went from something like 30 odd people to 180 within 2 years of that. So we built out clean rooms, production, and we took all the money, put it back in R&D, essentially created $1,000 disposables. So we created this product called transdiscal, which is ablating nerves in the disc, and that sold for like $1,200 US or something like that. So that was kind of the cash from that fueled the next growth for us. So we could take that cash and plow it back in and do all engineering work, R&D, set up clean rooms, quality systems.
So that was once again instrumental to you guys being able to bootstrap.
Exactly.
It's another level.
That's right.
It's still not total autonomous sales force, but can you talk a little bit about the trade-offs of that?
So there's lessons there too, but you're absolutely right, Scott. That allowed us now to say, and again, we'd already made the decision, we're not buying fancy cars, it's going back in and back in. And when we looked at that deal, we were quite proud that we had negotiated some strong minimums. But we quickly learned that they were hitting those minimums rather easily.
Right.
And because of the way they had said to us at the first time, we're not interested long-term being your distributor. If things go good, we want to buy you out based on sales. Well, guess what?
They control the sales.
They control the sales. And they had a certain volume that they had to sell, and they were right on. There's no problem. They even exceeded them. But we realized they could have been doing so much more. But were they really incentivized to do it? And I'm not knocking them or anything like that. Or was that like the drive? So we learned a great lesson there as well. After we ended up selling to them, they did end up buying, and then they'd be made successful. But we learned a lesson again that we wanted to further control our destiny. But the next time we went into the States, we would build our own sales force.
Right.
And if we had done that, we would have had a lot more options than that. But it was a very good deal, and it was a transformative deal for us.
Probably the deal that you could do was accessible at that time.
It was what was on the table, and it allowed us again to take it and grow to the next level. And even to the point we talked about, we developed this first high-cost disposable called transdiscal, which we never sold much of.
Right.
However, again, we took the core technology and applied it to another part of the body, synergy, which really took off. So I don't know if you want to talk about that.
So we're doing that disc development, and in order to ablate fairly large body instead of small nerves, we created what's called cooled RF. And we knew concept of this from cardiac and kind of applied it to pain medicine, adopted it, and then we applied it for first time for transdiscal, and it technically worked, but commercially it didn't kind of take off. We're able to take the same fundamental technology and apply it to sacroiliac joints for ablating nerves there, and there was hugely successful. So we were able to pivot that into it, and that's what ultimately led to Kimberly-Clark acquiring the business in 2009 and 9 timeframe. So able to, and that technology is still selling. I don't know how many hundreds of thousands of cases are done today. Now they applied it for
it's been a good business for them.
Well, they took it from the sacroiliac joint and they said, let's stick it in the knee. And knee pain is an enormous pain, and people are waiting for knees, and that's been beyond successful for them.
Even though what looked like initial failure with our discal product kind of converted into it. So I remember even the reason the cooled RF came along is kind of interesting story. We were working on a disc product, a blade nerves in a disc, and our engineer Mark Leong was working on it, and we came up with this beautiful catheter that was going to fish its way around the disc, and it's looking very, very good at that time. Then at we're finishing the development off, then lo and behold, we come across a patent from IP, and that from a company called Ortec, and that was exactly what we were working on. And back then, the searching wasn't as evidence. So you had to wait for paper IP to come out so you could look at it. So there we go. So we hit a brick wall on what we're going to do. You can't go any further along this line. So you think, do we give up? Do we go home? What do we do?
What did you do?
So then we started thinking again, okay, if you can't go this down, is it an alternative way of doing it? And from our cardiac work, we knew you could create very large lesions if you could cool the probe down. We said, let's try that idea in the spine space. And that idea worked. So we could create very large lesions.
And as a result, you're jumping across from one sort of indication to another.
That's right.
And companies are doing the cardiac are just not thinking about spine, basically.
That's right. Or you could take that same concept and adopt it in a different way here. So that's what eventually.
Yeah, because there was products that we were still developing. Still distributing in the one area, but we had our foot in the other area. And they were very, very similar, but they didn't know each other.
Right.
Even though they were like the same idea of ablating a nerve using radiofrequency energy. And even now they have pacing in the spine, like that's pacing. There's 2 parallel worlds that nobody knew about, but we had our foot. We had our foot in both of them. And the first generator, not to brag, but the first RF generator that when we sat down and worked with Stellartech and developed it, it was the first time they went from the old knobs and dials, as you see in a cockpit, to a computer. Right. And we actually patented that idea, but we never really tried to enforce it. But that first generator, when it came out, it was the idea that it's completely computerized, so it could do way more than the other ones, but way simpler at the same time.
Right, sure.
More powerful and simpler, easier to use. Now every generator is made that way, but that truly was our foundation, our idea. Now, from there, one of the companies in cardiology had seen that and said, "Can we license that and bring that back to cardiology? Your generator, that idea."
Yeah.
But when we said, "Look, we're going to put all that money in there. There's no disposable." We learned that lesson. So why do we want to make like 2 or 300?
Sounds like a good business, but
we
doesn't
said
actually work.
Yeah, there's nothing in it long term. So we chose not to take that back into cardiology because we didn't have the catheter.
Great. That's good business discipline. So now you're going into the U.S. and you're building out a sales force for this new product for the large lesion cooled catheter.
No, we didn't build our sales force for the large lesion. That was still through
Kimberly-Clark.
That was still
Kimberly-Clark, yeah. So they, in 2009, they acquired the business from us. They were not in distribution, so they acquired 2008 timeframe. We did 2008 or 9. We did the deal.
Yeah, sure.
And then we morphed into cardiovascular. We knew they were coming. They were going to acquire the business, so we had done some development work. Again, kind of related to our distribution business in left heart access. As a result of this kind of interesting story, we were importing a catheter for pulmonary atresia that was used by Dr. Lee Benson as sick kids, and it's for opening up a valve that goes from the heart to the lungs.
Yeah.
And for newborns, the valve is shut. So there's very few babies are born with that, but the valve is shut.
Yeah.
And he needed a system to cross that. So we were importing this wire from Germany, and it wasn't quite working. So it kind of worked every now and
let's
then.
not jump there.
Yeah,
It's more interesting than that, because what happens is, just remember when the doctor said I wanted to use this RF system from the brain into the heart, we said,
Yeah.
hang on a second. So we went to Osipka, and then we started selling her stuff. And they had like this other extra catheter for pulmonary, kind of like a throwaway.
Yeah.
And so Kris didn't even know what it was. We didn't know what it was, and you took it, remember? So tell that story, because that's kind of interesting.
Yeah, so Dr. Lee Benson wanted to use it, so
well,
he was
before you want to,
yeah.
before you walked in there with it, remember? Like,
I brought a sample in, and I took it to show it to him, and he goes, look, this is great. So he had a baby on a table, he needed to use it.
Right
so
there.
took it, told his nurse to sterilize it. Back then, he could do steam.
Yeah.
He could do steam sterilization.
but he
and used
didn't
it.
know that. I mean, these babies that have pulmonary atresia, you don't know when they're going to be born, and they need to be treated in the next couple days or not. And so it just so happens Kris is walking down the hall at sick kids. Hey, Dr. Benson, I got this catheter. I want to ask you, like, not in a sterile package or anything. And he's going, are you kidding me? He just takes it out of his hand, turns to his nurse, run and get this sterilized. It's like God was talking to look after that baby.
Oh my gosh.
You know what I mean? Like this catheter that's made somewhere in Germany.
That's crazy.
And he doesn't even leave his hospital. Some guy walks up and literally
There you go.
hands it to him. Granted, it wasn't sterilized; it was just a sample. But
They did the surgery. Did the surgery work?
Yeah, it worked.
Saved
from
the
what I can
baby?
recall.
That's pretty
like
amazing.
25 years ago. Yeah, so it's
probably a 25-year-old running around today that wouldn't be otherwise.
yeah. So that kind of got us into. Then he took the wire, and there were sick kids. Him and Dr. Nikkinen were using for crossing a septum for kids that are born with something called hypoplastic left heart. It's a very small left heart, and the septum is very thick, so they need to puncture across that.
Yeah.
And normally they do the needle, but then once they had the RF wire, they were using it for that. Then slowly adopted that from congenital defect to crossing the septum.
Yeah.
And so we kind of had that know-how, and then we started developing those set of products a little further.
So just
And
so
then-
the audience knows, when you go on the low pressure side of the heart and you punch across to the high pressure, that's the
right.
whole thing if you want to work on the left heart.
Exactly.
Yeah.
Exactly. Yeah.
And it's important to say too, like this was not an interesting product. It was a very small product, small market. So we started selling that, but it didn't work right the whole time. And there'd be cases where it didn't work, and that child would not make it or whatever. And I think Kris and I took a real strong decision there too. Said we're going to develop something that works. So it didn't start off. We said like this is not working right, and there again, like we got bigger business, bigger fish to fry. This is not that important to us. So we took that upon ourselves to work with Dr. Benson, Dr. Nikkinen, to develop the box and the wire that work very well together. And it's now the standard of care around the world. It's a very small market, but we developed that. But at some point, these doctors started using it for doing a transeptal for, as Kris said, hypoplastic left heart. So again, we go sit down, okay, what are you doing? why are you doing this? Why are you taking it? And then we said, okay, well, why don't we develop something exactly right for that instead of you gymming it? And that happens a lot with pediatrics, where there's stuff that's not made for the child. So these pediatric doctors have to take something that's made for an adult and play with it, or something that was made somewhere else. So they're very innovative. But we then said, okay, well, we'll do that for you. Let's learn, and that allowed us to build this market. That became our energy.
Genesis of our
That
cardiology
became
product
the
line.
whole big product line that you've just basically transacted on.
That is correct, yeah. So
That's
we,
amazing.
after the Kimberly-Clark acquisition in 2009, we morphed into cardiovascular space. So we took this product line, this kind of idea of transeptal, and even early as 2010, 11, we could kind of see the signals coming with the atrial fibrillation kind of being adopted at that time, being treated, that you needed access to the left heart. And we could see some of the earlier technologies of mitral valve and appendage occluders coming in. Then I think we were one of the first companies to put the idea together that all of these therapies need access to left atrium. So individually they're relatively low volume, but if you add them up, they add up into big business. So that was the first kind of insight in 2010 timeframe that kind of led us into this whole left heart access.
And there's an interesting lesson here, again, lessons that we've learned along the way.
Yeah.
So what we had was this wire for pulmonary atresia that gets redesigned to use it for crossing the septum, and it's a wire.
Yeah.
And we couldn't sell it. We could not sell it because it was making a hole in the heart, even for a cardiologist, is still a kind of a hairy thing. And they'll tell you that at least before us, that the scariest part of the needle is puncturing that heart, pushing that needle through. And so we thought we'd develop something interesting, but we then realized why we couldn't sell it. It was so foreign from what they're used to using a needle and that we just couldn't sell the wire. We couldn't get the uptake. So that led us to say, okay, there's needs, so we won't use a wire. We'll go to a radio frequency needle. So go from there.
Oh, I see. Interesting.
That's why
so
we went to.
How do you make it not look too different from their practice?
It was too far for them to go from a needle to a wire. Now, this is really fascinating because we stop halfway, then we go back. Instead of a wire, we come back and say, let's give you a needle. So you have all the same feel. So the way you set it up, you feel really comfortable. But instead of jamming it through, they used to call it the Zorro move because you'd have to go through, but not too far. So you have to go like halfway. But if you went too far, you went out the side of the heart. So you had to go halfway. Yeah. And if the septum was thick or fibrotic, they'd have to push. So you can imagine the stress on them.
Yeah.
Or if it was too thin, they'd push it instead of coming through it, go all the way to the left side of the heart, to the far wall, and they're going, oh my God. So we started, that led us to come back to a needle that was energized.
Yeah, and so remember with our team, Gareth and so forth, so our whole team developed that kind of 2009-10 time frame.
Yeah.
And different form of that, from going from wire to needle, kind of made it more familiar that they could use it. Yeah. And that got adopted, and we were lucky. We had some very good commercialization people in the U.S., and they're able to get kind of toehold in the U.S.
And this time we're building our own sales force.
This time.
By commercialization, you mean your own sales force,
that is
sales
correct.
VPs, and
we started, what we did again is we started very small, and we had a pay-as-you-go. So we had someone in Vancouver, and someone in Toronto, and someone in Montreal, Canadians that would fly down in the week, sell. And once we had enough business, we hired our first U.S.
Right.
And then we went very step by step. We didn't go, again, it speaks to why did we not need venture capital money? Because building a sales force is very expensive, but we had a pay-as-you-go. Once that territory can handle someone, we put an American in there, like hired a local person.
Sure. Yeah.
But we actually started just flying in and out till we built the market up.
So that's remarkable. So we're going to have to keep moving forward. We've got about 13 minutes until we want to get to audience Q&A. So let's get to the end of the transaction in 13 minutes.
Yeah, please.
So,
But it's important before we get, now what happens with the NRG is we come back. So when we sell, you can explain why we went to the back. We actually come back.
Yeah, so just in terms of business, kind of, because we have pay-as-you-go model and we were not going to raise money, we had to develop kind of the business relatively slowly by having one sales guy, then two sales guys.
Yeah.
And this time we actually had like $500 disposable business.
Yeah.
And as that business was kind of taken off, we were able to take that cash flow and grow our R&D and operations out quite a bit, so we could control our destination further and get reduced margin. Then we had another kind of very major pivot point, which was that we were fortunate enough to partner with our Japanese partner, Japan Lifeline. In 2013, they got the product approved in Japan and got reimbursement for the RF needle in Japan. And overnight, we went from 0% market share in Japan to 100% market share.
Wow.
And our Japan Lifeline was a great partner. They would pay us on time, right on clock. And we were able to use that very steady, strong cash flow, plow into R&D, and we developed whole armament of products, from needle to sheets, steerable sheets, guide wires, all kinds of products we developed. And we grew our kind of operations from 100-odd people to 500 people, went from 1 clean room to 4 clean rooms. So we were able to take all that, grow at a very, very rapid rate.
Yeah.
So between 2010 till now, we were growing roughly between 30 to 35% a year.
That's a lot when you got to build facilities to house 35% more people.
Yeah, you're mathematically doubling every 2.25 years. So you kind of had to kind of account for all of that.
Yeah.
And so we ended up with a number of buildings, folks, and the cash flow from Japan really helped to grow the U.S. sales team, as well as our operations out, and develop a number of whole armament of products that we could be.
Yeah, and you're looking at it in retrospect, saying we're doubling, but we don't know that looking forward. So we're making decisions, and then we would get a building and go, darn, we're kind of full. And then because we didn't know that, but we were thinking like that. Yeah.
I remember walking. The building at 27, we got it, and it's a huge building. I remember walking around with Laura Congregate, our head of operations back then, which she still is. and saying, man, this is a huge building. What are we ever going to do? This is like, we made a huge mistake here.
Yes.
And 3 years later, it's filled because of the doubling at that rate, right? So
Remarkable.
3 years later, okay, we need another building now.
And
so
you're still growing at that rate.
the business is still growing at this rate. So we transacted in February of this year and was growing at that rate, and it's probably accelerated now post-COVID.
And it's accelerated.
So,
It's coming
sure.
back, and just coming back to
Yeah.
that wire. So when
Yeah.
we went to sell and talking about that transaction, one of the things, we were growing at a great rate, but we also had a new product coming on that was going to grow even faster. And guess what it was? It was going back to making the Transepto with the wire.
The
now.
wire. Now people
They were
are
now
for it.
ready.
Yeah.
They were now ready for what we had tried to do 10 years earlier, which was
Yeah.
too far, and now they could all see the value in the wire.
Yeah.
And we refined it, made it better as well.
Yeah,
sure.
And that is just that we launched in the middle of COVID, and it just
Right.
took off.
Amazing.
Like we didn't think it would,
Sure.
but it just the interest was so strong then. But it's interesting to say that we'd actually tried that. So it's a lesson that you might be early to the market.
Right.
You might have something great, but the market's not quite ready for
Ready
you.
for you, and you still got to stay alive for those 5 or 10 years.
Yeah.
That's right.
Yeah.
Yeah. So let's maybe diverge just slightly to talk about the board, because somewhere in here you decided, let's go get a board, because people
Yeah.
said it's a good idea, and whether you liked it or not.
Yeah, in 2015, kind of the change occurred where Frank decided to go into politics to run
As
for
one does.
federal government. As one does, yeah. So we're growing to 2010, 15 at a very rapid rate, and he goes, Mike, well, go ahead, tell your story about
Yeah, so I was
politics.
walking and then I hit my head, and then, it's a dream I always had, and I turned 50, and there was an opportunity, and Kris wasn't too happy about this idea, but I think that I really think in retrospect it's worked out very well. I think that we made a bunch of changes. I was somewhat reluctant to, and you talked about the board. I wasn't ready for a board, and we said, okay, if I'm going to leave, we need to make sure we have better structures in place and sounder structures. And one of them was to put in place a board of advisors. Because we are owners and managers, board of directors per se, which is hired by the shareholders to manage the managers, made no sense. We call them board of advisors, but they're, let's say for all intent and purposes, they are now a board of directors. And we said, if we're going to do this, we have to also be ready to listen so that we don't waste their time or our time. And I think that having that board of directors, again, it's something that another entrepreneur had told me 10, 15 years earlier, how he had done this and it was amazing. And I was like, I don't need that. And I was completely wrong again. And I think that they brought in tremendous value to us.
Yeah, so I remember the first board meeting was in January 2015, 9 months before Frank left. And that, I think, added a lot of value. We had two very strong board, very supportive board, two folks from Medtech industry, two from non-Medtech, and just the process of having them and getting ready to meet with them every quarter kind of forces a set of thinking. If you're going to have a financial plan, you have to make some conclusions out of it. You have to be brutally honest with yourself because they're going to call you out on that. So that kind of forces a discipline to look at your own data and make some decisions. And once you kind of agree to a plan, you have to kind of follow up. So for instance, if we agree you're going to have a CFO, you can't go back to third meetings and say you haven't done anything about that.
Right. That sense of accountability
into that, and that forced it.
Yeah, they did a couple things like that for us. They challenged some of my thinking. For example, I said that can't be done. They go, well, no, Frank, you're wrong. Like, it's done all the time. I go, no, it can't. But then they were right. So I had to rethink. So, like maybe I was mentally roadblocked someplace, and they said, no, you can do that. And the other thing they were able to do is they had worked in bigger organizations, and they said, yeah, this is great when you're this size. And remember, we're growing all the time. And they said, well, if you want to get here, you're going to need to bring in this kind of skill set. You don't have it, and you don't know what you don't even know that you don't know, that you don't have this. It's what you don't even know. But they were able to point things out to us. So, for example, bringing a CFO, we said, well, we need that. We got a controller. Everything is good. He goes, no, you don't understand. And they challenged that thinking. So it kind of broke the mold open that we could see bigger. And they had that experience, some had been successful startup guys, and some had run big organizations, but they saw broader that we could see.
Interesting. That's great. So let's talk about the transaction and what was the thinking that led to it, and kind of what was the process like.
Yeah, so we were building, first of all, business for long-term growth or retaining it. So we were building infrastructure, people, markets. We had committed to opening a plant in Costa Rica to support next order of growth for us. So we were invested as if we're going to run the business for a long time.
Yeah.
Then COVID comes along, then market changed drastically, so the healthcare industry changed drastically. In January 21, January, February 21, with our board's help, we kind of looked at our business to see where are we and where we kind of headed. And what kind of served us being self-funded so far was kind of becoming a deterrent in a way that if we want to diversify, we have to kind of acquire companies to do that at faster rate than we could do internal development. In order to acquire companies, you need cash. So you either have to go public or get private equity, which is just a form of an exit anyhow. So it became very clear that we're a 1,000-people company, we're a single product line in transseptal space, and in order for diversify, our capital structure has to change.
Right.
Or you could retain, you could stay as a single product company and all the risks that come with that.
And you're doing in the range of hundreds of millions of dollars of revenues at this time.
Yeah, the Boston, said Boston is going to do in calendar 22 about $200 million US dollar revenue. So back then we probably had about $150 million business.
Right.
Yeah, so it's a fairly sizable business. We're cash flow positive. It's a very good business, but we had this inherent vulnerability as a single product company and capital structure that limited us to acquiring a lot of cash so we could do it. And plus, wasn't in our DNA to buy companies, something we never done before. That kind of.
I'd say what happened is we became a victim of our own success. So we're no longer under the radar. People know about it and that. And then we come to another inflection point. You either become bigger or you join someone that's bigger.
Right.
And to come bigger, you could go public, but Kris and I had absolutely no interest in going public. You could take on a lot of money and then acquire and start building out like that. And we just didn't want, we were masters of our own domain, and we just didn't want to go down those paths.
Sure.
So it would be too risky to continue to grow and be on a single product. We had tried some other technologies that didn't work out. Had they worked out, we might have already been broadly based enough that we could have stood on our own with our own internal development. But markets shifted on us, and so ideas that we had that we thought were going to be our next big thing didn't work out. So we said to ourselves, do we want to go public? Do we want to take on private equity and start buying and become bigger? Or do we want to join a good organization? And where are we at our lives? How old are we? All these things come together, and we said, look, the best for us is to go with the right strategic. Find the right strategic person that's the right fit for us and our people, as opposed to that, because we just didn't want to go the other routes. So that's what led us to that point. Is just that in evaluating the business from an objective third perspective, talking with the board, you can't be half pregnant. You either got to get even bigger so that we become another strategic ourselves, or we join a strategic.
Right.
That's what came to us.
Great.
So once we kind of, again, board was instrumental in helping us kind of formulate that thought into that. Then we said, if we're gonna, unlike the first transaction we did when we sold our business to Kimberly-Clark, where we had limited optionality because they were distributing for us, so they kind of had strange hold, and no other bidder would kind of step up at that time. We said, okay, in order to maximize our revenue, we really need a set of optionalities. So we hired a investment banker. We interviewed a bunch of bankers, and we chose one, and they ran a full process of kind of creating pitch book and the data rooms and so forth. And we went through a full kind of bid process through a couple of rounds. And business was very strong, so we were profitable. We had size. We had scale and we had growth. And
we also had what they like to sizzle, because we had this wire. Remember, we tried. Now we're just coming onto the market, and right in the middle of COVID, it was just taken off. So they could look at that too and talk to their own doctors and say, "Yeah, this is the next." So we were going to eat our own lunch and everybody else's lunch with that. So we had all those things came together for us.
And we had a very strong team internally that helped us get our all the data together, do all the pitches.
Your own operational team,
CFO
of course, team, et cetera.
CFO had our operations, had our R&D, regulatory, quality. All those folks were obviously very seasoned into it, but first time doing a divestiture. But we all pitched in heavily, worked around the clock to get the data together, and then the bankers were very good. We met public Piper Sandler. JP Peltier did a phenomenal job of putting the pitch book and walking us through the process and navigating through negotiations and so forth. Amazing. But business being strong, having scale and growth and profitability attracted a lot of attention. And as a result, we ended up where we did as a result of how strong the business was, and the environment at that time. The multiple revenues were quite high at that time.
Pretty remarkable. A 30-year-old company gets 10x multiple or thereabouts on
That's right,
revenues.
revenue. Yeah, I know, and that is not just headline number, but even the structure of the deal was very favorable.
Yeah.
And then even commitment to keeping the operations in Canada.
Yeah, we were.
Yeah, so a number of factors that would take care of our team were also very strong.
Yeah, we were lucky, and we were the pretty girl at the dance at that time, and there was a lot of interested parties, so that really played to our favor. And not to brag, but we had more than the technology and the IP. What happened is the first round of number came in, and we whittled it down based on the first offers, and all the offers went up after they looked at our people and our structures and our processes. So we had not been building a project to be quickly sold. We had been building a company, and we had been, through the guidance of our boards, getting great people in, having that full operation. So they didn't just buy the product or the IP. They bought the people, and not only to that point is that because we continued our business in radiology and that we have here, but they were very, very strict on us not poaching any of our people to the last person. They wanted not just the business, that they wanted everybody to allow them to continue to grow even faster than what we were doing.
Sure.
You know?
Remarkable.
Yeah.
Well, congratulations. That's it.
Yeah, thank you. We're fortunate. We had a very, very strong team with us, and the markets were very friendly at that time. They still are very, I suppose, and that kind of helped to transact into that. And just one last thing to Frank's point, when you go through this process, all the companies look at what you do first, like how do you make revenues. They look at what of the business. Then in a second phase, essentially look at who are you, like what does the team look like, and how do you do this.
Yeah.
And I can tell you the strength of the team, that people came out feeling better about us after the second phase once they knew the team and our processes more than just our revenue number.
Remarkable.
So,
That speaks to you. I suspect you're the one who is keeping the lid on operations.
No, we work together onto it.
I think we had
so we had a strong team.
You sit here and you interview two people, and we are just a reflection. But I never made one catheter. I didn't design the catheters, neither, because we had amazing people. So I think it's really important. I can't stress that enough. Though credit goes to a handful of people, but I think throughout the organization, from the person that was making the catheter, keeping the clean room clean, right to the person developing it, the person doing the IP, the person selling it, the controllers, all of it. We had a very dedicated. We were blessed to have such a great workforce.
And the QA people too. Just
Absolutely.
Sure the
QA as well. Yeah, I don't want to miss anybody.
Exactly.
No, but all of those things, all of those things came together, and as I said, Kris underlined it. The more they looked at it, the more they said, "Okay, we want this organization as part of our organization."
Yeah, sure. Amazing. Great. Thank you. We've got 8 minutes left, and I want to spend a couple minutes doing a wrap up. So let's take a look at a couple audience questions for you.
Absolutely.
So let's see here. Do you have challenges working together, or was it smooth all those years? From Mick Jane.
Do you want to show the scars? No. Are you going? Yeah.
We've been together for many, many years. There certainly are a lot of challenges that occur during this time, no doubt about that. But a couple of things that kind of helped and still do, I suppose, is that kind of going back to the genesis of being our own people, having entrepreneurship, that being constant, and trying to build a business together and having long-term strategic view and being constant on that and agreeing fully on that's really helped. That's kind of becomes your true north. Then you may debate the tactics all the time, but at least you know where you're going to end up.
We had decided what mountain we're going to climb, and there was no question which kind of mountain we wanted to climb and how. Then you might argue which pathway do you take up the mountain? So I think that having we were completely rowing in the same direction. How you rowed, whatever we might have developed it, debated on it. But I think there's also a respect, and I think we each brought different things to the table. And if there wasn't that classic pull and push, then one of us was not needed. And I think a third thing is that we weren't really interested in assigning blame. We made a lot of mistakes, but we made a lot of hits too. So, and we didn't need to worry about why did it work or not. So, and I think that those things coalesce together, and underlying all that is, I would say that we have the same fundamental values.
That's right. Yeah.
What we want to do and how we want to go about business and that. So those kind of really important things never came up. So it's like any marriage or any kind of long-term partnership. You have to be with someone that your fundamental values are aligned and what kind of life you want to live is aligned.
Sure.
And so we started with that base.
That's remarkable. Right from the very first day at the Board of Education until now.
Yeah, so now we certainly have our set of challenges, even when Frank went politics, as Frank mentioned, I wasn't
He wasn't too happy
with that. But you water your wine and you move forward, and obviously kind of the long-term vision is constant. That helped. The other one for the audience that I think that helped keep us together is that our economic interests were always aligned 100% through all this 40 years. So it wasn't a debate.
Yeah.
You're doing this, that's going to make you more money or more economics. So economics were always 100% aligned. That I think also helped.
It's kind of ironic that all this time you haven't been taking out much money. You've been pouring it all back in the business, and now you sit on mountains.
I'd say it comes back from both of our upbringings too. We're both children of immigrants that came and had to work their way up and not given to them. So we had grew up different parts of the country maybe, but very fundamentally had seen our parents work hard and build their own successes. And so we came with a core set, those core values and the core way of doing things were aligned. So one wasn't saying like, I want to pour all the money back into business, guys. No, I made it. I'm going to buy myself a nice big Mercedes. Those things were never debated. We're going up this mountain and we're putting it all back in there.
Remarkable.
Yeah.
So I think I'll do one more question.
Yeah.
So that was a wonderful. So one is that, can you share your recipe for acquiring talent?
Yeah, okay. That's an excellent question, and
I'll tell you a couple of things that in that area. So in our company, right from the beginning, we had kind of 4 corporate tenets that we kind of stuck to, and then being technological innovation, customer service, third being patient-centric, and fourth being employee development. So in terms of talent, attracting, retaining, and growing, I think the last 2 in terms of patient centricity and employee development were absolute key. So patient centricity meaning this is why we get up in the morning and come to work.
Right.
Okay, so we have strong why we do this, and which being patient oriented, doing the right technology. So that attracts a mindset of a greater purpose that people want to achieve towards. And second thing we had was employee development, that meaning we're going to develop all our staff to the highest level we can. So we spend a lot of resources in development, formal courses, mentoring, giving opportunities. So when we go to trade show, we take most number of engineers to the trade show.
Right.
Because we can educate them. So the emphasis on education, and we have to educate ourselves by example. So we spend a lot of time educating ourselves, keeping up with clinical data and so forth.
Yeah.
So investment in employee development combined with a strong reason to show up to work every day is what I think attracted talent, retained, and helped them grow.
You mean that created a reputation that people
a bit of reputation, and then
a good place
people.
to go.
Well, I think it comes back to and this goes right back to my mother, her why. And we adopted her why. My mother was a nurse, and before this nomenclature even existed, she had what we call patient-centric view. So there's one fella, you may be watching even, where he had done something. He was one of our first salespeople to save us a bit of money, but may not have been the best thing for the patient. She fired him on the spot.
Right.
He was worried. I said, don't go away, come back in 2 days and apologize and that. But she set a tone which was that we were going to do what's right for the patient. Yeah. And we worked hard to maintain that. My mother's since passed away, but we had a very clear why. And you hear about this, people talk about what's your why in that, and why do you get up in the morning. And so to retain talent, you got to teach your people with respect and respect them and listen to them and give them a great work environment and all that. But I also think you have to have a why that you really stick to, and you don't, you never cross that line of what your why is. Sure. And we have a clear why we're doing what we're doing. We're proud of it. Around the world, people have benefited from technologies that we've conceived and developed or just imported even and brought to Canada. Sure. So we're very proud of that. And we want to share that. And if we find someone that's in the workplace and they want to be part of our why, well, then there's a fit.
Great.
There's a fit. And that helps us retain talent.
Remarkable. There you go. Well, that's all the time we have today.
All right.
I wish I could talk to you for another 2 hours because that was so amazing. But big thanks to Frank and to Kris.
No, thank you, Scott, for being a great host and thinking of this idea and investing in this. It's not easy.
I think it's important. I hope that a lot of people get benefit from today and from this. It'll be online. People can be watching it for years. It's a slow-growing story, so it'll still be meaningful for a long time. Thanks for watching. If you're interested in learning more about StarFish, we've been in the business for 23 years. We've worked on hundreds of products. We've helped many startup founders become very successful. In fact, we really think of ourselves as the lean medtech startup partner. What does that mean? It really means doing the right amount as efficiently as possible to get the next round, to become valuable, those valuation milestones. And if you're a larger corporate, guess what? Those investment milestones look a lot like your thresholds, your gates that you have in your corporate approval process. So we're just ideally suited for that. In each of our lobbies and our offices, we have a 100 by 100 wall. What that means is we want to have 100 clients who become worth more than $100 million through the work that we do for them. And also, we would like them to touch the lives of over 100 million people. We think it's a powerful mission. If you think so too, we'd love to talk to you.